Can healthcare reform happen? What are the prospects? What would it look like? And then I think it would be good to say, how does that tie into tax reform?
Mm-hmm. So first of all, it's great to be with you all this morning, and I guess we're getting some more rain, it's been a rainy year for us. Anyway, I am of the view that the fact that President Trump and the Republican Congress started with health care reform as their first major agenda item is very indicative of the amount of political pressure they feel to really move forward some kind of activity to repeal and replace the Affordable Care Act. Now, the challenge, as they're discovering now, is that even Republicans can't agree on what that vehicle looks like. What does it look like to replace Obamacare? For 7 years, Republicans have been very clear that they want to repeal Obamacare. That's almost the easy part. The hard part is figuring out how do you get everybody together with a solution that can actually bridge the divide. And I think that's the process the U.S. Senate will go through over the next several weeks. Senator McConnell, the majority leader of the U.S. Senate, has indicated his intention to move forward on health care reform by the July 4th recess, which is a pretty ambitious timeline. Congress, as they do often, is on vacation this week. And then they'll come back next week, and they will be in session for 3 weeks ahead of the July 4th recess. And McConnell's idea is that they're going to get health care done in those 3 weeks. The challenge, as many of you who follow this issue know, is that there are a couple of really fundamental issues on which Republicans have disagreements. And so the negotiation, at least initially, is going to focus on how to get Republicans together on these 3 issues. One is Medicaid. Medicaid is the low-income health care program that the ACA expanded significantly. In fact, some studies suggest that up to 80% of the coverage gains in the ACA came from the Medicaid expansion. The Medicaid expansion was largely an optional expansion after the Supreme Court decided in 2012 that the federal government couldn't force states to do it. So now you have this interesting dynamic where Republicans disagree with one another, because there are some Republicans that come from states like Ohio that took the Medicaid expansion and therefore are very vested in ensuring the current system continues. And then you've got other Republicans from states like Texas that didn't take it. So they would very much like to see the field be equalized. So Republicans have these disagreements, and of course what the House passed this big bill a few weeks ago, that really fundamentally changes how Medicaid's going to be financed and is going to place some real fiscal pressure on states that have a lot of Medicaid patients, like California. So that first issue is Medicaid. The second issue is, what do you do about all the regulations in Obamacare? And all of you in here are job creators. You understand this very much, that Obamacare has a significant regulatory overlay. Now, there's some things about that people like, some things about that people don't like. But the Republican premise had always been, well, we want to get rid of as many of those regulations as we can. The problem is the process they're using to repeal and replace Obamacare is this sort of convoluted legislative process called budget reconciliation that has all these crazy rules, one of which is, in order to use budget reconciliation to deal with a particular legislative issue, it's got to have a direct impact on spending or on revenue. So that really limits how many regulations the Republicans can knock out using reconciliation. So now the big question in the Senate is, how far do they go? The House had this interesting idea that states could basically make a decision for themselves. If they wanted to waive regulations, they could do so, but it would not be federally imposed. We'll see if that is allowable under the rules of budget reconciliation. So that's the second issue. The final thing is pre-existing conditions. And this really gets to what I think the core of the political argument of Obamacare is about. That really what President Obama ended up doing was taking this huge transformation of our healthcare system and really selling it as a way to deal with pre-existing conditions. Now, the law gets to that in a very sort of significant way by imposing these standard uniform regulations at the federal level. What plans have to cover is regulated by the federal government. The fact that plans have to offer coverage regardless of health condition, that is a federal requirement. And then how much health insurance plans can charge, that's now dictated by the federal government. And that's essentially how Obamacare deals with pre-existing conditions. The Republican approach is very different. The Republican approach says, okay, let's take the people who have pre-existing conditions, let's separate them from the rest of the risk pool to bring down premiums for more consumers and target assistance at those who really need it. The challenge with that is you've got to spend a lot of money to get there. And are Republicans going to be willing to spend the amount of money, to Allan's point earlier about creating entitlements and the fiscal concerns a lot of Republicans have? Are they going to be able to spend enough money to get costs down for people with pre-existing conditions? And that remains a big question. So those three big issues really are at the center of the Senate trying to deal with all of this. I'm still relatively confident, actually, that the Senate can arrive at some agreement on a legislative vehicle to move this process of repeal and replace forward. The difficult part of it is going to be, can they sell that compromise, whatever they come up with in the Senate, to people in the House? Because remember, it's got to go back to the House. The House has got to sign off on the same piece of legislation before it gets to Trump's desk. That's where the difficult part's going to come. And I would carefully watch Ted Cruz, a name that everyone I'm sure in here knows. I'd watch someone like Ted Cruz. Ted Cruz is at the center of these negotiations in the Senate now. And if he is able to get on board with whatever they pass in the Senate, he's going to be a very effective spokesman to the conservatives in the House. So I still think better than 50% odds they get something out of the Senate, probably right around 50% odds that they get something to Trump's desk. Whether it looks anything like what passed the House is a different question. I think what passed the House is likely not going to look anything like what will pass the Senate. I think what will pass the Senate will look, at least initially, much more moderate to most people.